This is Anatomy and Physiology, Chapter 5, the Integumentary System, Video 15. So in this video, we're going to start talking about skin cancer. And this is something that in the past decade or so has been on the increase, especially with younger people. And the cause of this is ultraviolet radiation from the sun or from tanning beds. And what the UV radiation does is it causes mutations in the DNA of skin cells. And depending on which skin cells are going to be mutated tells us a different type of skin cancer that we have. So the three most common types of skin cancer we're going to go over. And the first one is going to be called basal cell carcinoma. So if you remember from our medical terminology, oma means tumor, carcin means cancer. So this is a cancer tumor of the basal cells. This is the most common form of skin cancer. It affects the stratum basale layer of the epidermis. So this is a cancer of epithelial tissue. It has a varied appearance, and I will put some pictures of these different types of cancers. Some of them are a little bit graphic because they involve different removal of skin, but you'll be able to see what some of these cancers look like, and you can do a quick search to do that too. So to get rid of this, removal or destruction of the cancerous tissue cures most cases. So of all the ones, the most common form is also one that really can be treated without any kind of radiation. And the only bad thing is if it's a large basal cell carcinoma, it's on your face, you might have a lot of scarring. But they can heat the tissue or freeze the tissue also to kill that tissue. And since it's in the epidermis, they might not have to go the whole way down into the dermal layer, but they might take a little bit of the dermis as a precaution. The next one is called squamous cell carcinoma. And this affects the stratum spinosum. And usually this can arise from small, scaly, crusty bumps on the skin called actinic keratosis. So there can be these little bumps that form on the skin, usually in an area where there is an overabundance of keratin being produced. A lot of times people will get these if they wear glasses and it's rubbing on their temples, and you can get like this little crusty thing, and sometimes they go away, but they can develop into a cancer. And these usually appear in a varied appearance too, but they tend to be wart-like, a scaly red patch, an open sore, or an elevated growth. So again, varied appearance. Removal cures most, but radiation may be needed. So this one's a little bit more serious than basal cell carcinoma. All cancers are serious, but not as bad. And then the last one is the one that you have to worry about the most, and that is melanoma. This is the least common, but it's also the most deadly. This affects melanocytes. And most of the time, these are brown or black patches on the skin. They look pretty gnarly. 40% of melanomas arise from moles. So if you remember, a mole is an overactive area of melanocytes and a buildup of melanin. So we said before that moles can eventually increase your risk of cancer. So people that do have a lot of moles, especially as you get older, if you're exposed, you get a lot of sunburns, that increases your chances of developing melanoma. If this is contained in the epidermis, it's usually curable. If it invades the dermis, it can spread, and it's known as malignant melanoma. And that's what the term malignant means, that it is spread to a different area. One of the most common places for melanoma, if it goes unchecked, is it can go to the brain and it can develop cancer in the brain, which is very, very bad. Next, we have a way that doctors will use and we can use to describe or detect skin cancer in this ABCDE system. So this is usually for any type of growth on the skin that may be suspected. Please, 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 if you ever see anything or have any of these symptoms that we're going to talk about, see your doctor. It might be nothing, but if you catch it early enough, it's very, very treatable. So A stands for asymmetry. So if we look at something on the skin and it looks very asymmetrical, especially a mole, it's best to get it checked. B stands for border irregularity. So if you look around the edge and the edge is kind of fuzzy on one side, then you might want to get that checked out. C is a color change. So a mole gets darker, or something on your skin was red and it's starting to turn brown or black. Go see a doctor. Anything that has a diameter greater than 6 millimeters should be checked out by a doctor. And E stands for evolving. So something changes. Maybe there's hair growing out the middle of the mole and it all fell out. Maybe the top of the mole kind of started to indent a little bit. Get it checked out. If you are prone to moles and you are at a higher risk for skin cancer, you might even want to make an appointment at a dermatologist, and they will actually have you on a table, look over every inch of your body, between your toes, your toenails, even in places where you might not examine all the time, if you get my drift, and they will look for all of these different things with moles, places that you might not think of where skin cancer can develop. So anywhere where you have skin, there is the possibility that it could be. So you might not be able to see certain areas of your body, so you go to a doctor and they will examine that.